Samantha. Thank you for coming in today. How are you doing today?
I'm doing okay. It was a little bit of a rough morning with Timothy. He was giving me a really hard time, but we're trying to make it through.
Yeah. Can you tell me a little bit about, what that rough time is looking like in the morning?
Well, he refuses to do everything.
Mm-hmm.
He just seems like he honestly hates me. Every time I ask him to do something, it's the opposite that he wants to do. It's hard to get him dressed in the morning, to eat his breakfast in the morning. If it's me instructing him, he's not going to listen. And it's just creating this frustration between us. And I feel bad as a mom that it's even there. But
Mm-hmm.
I feel like everything I've tried, he's just not listening. He doesn't want to listen. I don't know. I don't know what it is. Does he not want to listen? Is he upset that he has to go to school?
Mm-hmm.
I don't understand why he's acting this way.
Yeah, and that can be really frustrating, especially in the morning when you're trying to get them dressed and
Mm-hmm.
get to school on time. So I totally hear you on that. So is that a little bit about, why you came in? You're seeking some filial therapy.
Yeah,
Um,
yeah, I definitely would like to get a good understanding of what that may look like and how it might benefit him and I because it's we need something. I'm really open to any kind of suggestions or therapy.
okay, perfect. Well, I'm glad that you came in. So, to explain a little bit about filial therapy, I'm not sure if you did much research, which is fine, but it's a very child-directed as well as parent-directed intervention. Me as the therapist, I don't do too much. I'm here to educate you as the parent in conducting some non-directive play. And so this will happen in 4 phases. We have our first session today, just some background knowledge, and you getting to know what the therapy is, and then we move on to structuring, which will take a few sessions, um, and then there's the child-centered imaginary play, which is when it's the supervised play in the clinical setting. So it would be here in the
Okay.
office. You and your child would come in. If you'd like your husband to participate, that's fine as well. It's not required. Um, and then a few sessions of that, that'll be about 30 minutes, 30 minutes to an hour each session. Then it'll move on to the limit setting, okay, and that'll be some home
Okay.
unsupervised. And then lastly, we'll talk about the play themes.
Okay.
So the themes that you see within the play. But the goal of it is to really let your child show you what they want to do. You know, you can essentially say to them, you have all these toys. We'll have a lot of options in the playroom. They are allowed to do whatever they would like. Obviously, safety is a big important part of it. So really the only times you would intervene are when it's getting dangerous.
Mm-hmm.
But other than that, you just kind of go along with it. And some of the research has shown that this can really build the parent-child relationship, and it has also been shown to reduce parental stress, your empathy towards your child improving, your child can improve their self-esteem.
Mm-hmm.
So there are quite a few benefits. So if this seems like something that you're interested in, we can definitely continue on with it. I do have a few things for you to sign. Okay, here are the forms. And then do you have any questions for me?
Yeah, as you were kind of talking about the phases that we go through, could you give me a little bit more information about what the structuring means?
Yeah, so structuring, that is, really going to look like the length of time
Okay.
that we do the non-directive play,
Okay.
as well as the area that is set up.
Mm-hmm.
When we're in the clinical setting here in the office, we have a dedicated playroom,
Okay.
um, with many different toys. When we get to the home portion, however, that's when it's going to be really important to set up very specific areas,
Okay.
and toys that go along with it, as well as differentiating with your child,
Okay.
that this is special playtime and not regular playtime.
Okay. And are these areas like something that I'm picking out, or is it like a themed area that you recommend that best associates with this therapy?
In the home, it can be wherever you feel comfortable
Okay.
performing it. And again, it'll be about 30-minute intervals, and those will be unsupervised. So that'll
Okay.
be just you and your family or your child.
Okay. Um, and another question I had was, what is the connection between this play
Mm-hmm.
and our relationship? Like,
Mm-hmm.
how does this help us?
Yeah, that's a great question. And many people, um, have that question, and they're a little skeptical about play therapy being beneficial. Um, However, the reason for that effect is the non-directive play gives your child the chance to have
Mm-hmm.
control, and through play we um, express things a lot more freely,
Mm-hmm.
and this can open up conversations between you and your child. They may be struggling with something at school that you weren't aware of that comes out during this special play.
Okay.
So it can really, that's kind of how it deepens that connection.
Okay.
It just opens up more doors and windows for conversations.
Okay.
So yeah.
Between me and my son, right?
Yes. Yeah.
Okay. Okay. Kind of giving him that control to.
Mm-hmm.
Okay. Okay. So when would we start that first session?
Um, so if you're okay with it, and I know you brought your son today, um, we would start with, after this
Okay.
background, with an uh, unobserved, well, so that'll be an unstructured playtime that I would observe with you and your child. We have a two-way window, so, well, one-way window, so I can observe um, unobstructed, and you and your child can play freely.
Okay. And in that unstructured playtime, am I supposed to play with him? I don't know how to say this. I guess
Mm-hmm.
normally, or am I trying to let him play and I'm just there present, or am I
Mm-hmm.
trying to engage with him the entire time?
Yeah. So this unstructured playtime is just not unstructured. So there's, you can,
Whatever happens.
whatever happens, it gives us a baseline to see where you're at with play, so that
Okay.
we can, really get an idea of where to start and
Okay.
where, we can go from here. Um, and were you curious about kind of how long the all the sessions together,
Yeah, yeah.
about how long? So it is a short term intervention. So
Okay.
it's about 10 weeks. It can be increased and prolonged,
Mm-hmm.
depending on your comfort. If after a few sessions in office, if you don't feel comfortable doing the home sessions, or you get to the home sessions and you would like those to continue for longer, we can definitely extend
Okay.
a little bit.
Okay.
Um, and when we get to the home sessions, it is unsupervised, but it's not. Um, you will still meet afterwards in the office,
Okay.
um, to go over any concerns that you had. And if you're unable to do it that week, we'll kind of come up with a plan uh, to get it done.
Mm-hmm.
Um, so that's about how it looks.
Okay. And if my husband were to be involved,
Mm-hmm.
would you say that he needs to get involved now, or can he come in intermittently? Like, how would that affect
Mm-hmm.
this therapy? If he does he need to start now or not be involved at all?
Mm-hmm.
What would you recommend?
Um, I would say it's, kind of based on your comfort. I do believe, um, if he gets involved now, it could be more beneficial rather than, in and out, because I think the consistency would be good for Timothy.
Okay. Mm-hmm.
So that's
I
that's
think
kind of what
Timothy needs that.
what I would recommend.
Okay.
Well,
Well, I'm really looking forward to this, and like I said, I'm willing to try anything. So we can try this, and if we finish the sessions and it's not working, then we can just go ahead and try something else.
awesome. All right. Well, thank you for coming in, and we'll dive right into that unstructured
Okay,
playtime.
let's go do that. Thank you.